John David Sprandio Jr. I'm a medical oncologist and hematologist at Consultants in Medical Oncology and Hematology. So I became a medical oncologist primarily because I saw firsthand what it was like to grow up with a physician and a nurse at home. My father's a medical oncologist. My mother was a nurse. Both really enjoyed developing relationships with their patients. Seeing my father and growing up with him, being my father, really seemed to be an honorable profession, knowing and taking care of people. And that ultimately became my passion and why I decided to become a medical oncologist. So I really enjoy meeting people and developing relationships. So more often than not, we're meeting patients that are at a pretty difficult time in their lives. And there's a lot of gravity to that situation, and it's often quite overwhelming. Again, when you come here, I feel like it's so much of a home environment where you feel like you become part of the family, and I personally feel like I develop these wonderful relationships with patients over time throughout their course of care, where the patient's engaged, we're engaged in their care, and I feel like I'm making an impact in their lives that's often positive, even though the situation may be difficult. And I think that's really where I get my passion. That's why I feel motivated every day when I come to work, and that's clearly why I enjoy being within the practice here and taking care of patients. CMOH is a patient-centered medical home, and when you walk in the door, you really feel like you're home. From the administrative staff and the secretaries and patient navigators, setting up all the patient's appointments and imaging, you're really not left alone there. From the healthcare staff, nursing staff, chemo infusion nurses, physicians, we're all very easily accessible and all here to help guide you through every step of the process. We have an excellent nursing triage system, so if there's any management issues during the course of someone's care, easily accessible with a phone call or even a patient portal message. There's a certain comfort level here too, where personally I don't mind sharing my cell phone number, and I think that's reflected in a lot of our staff here, including most of the physicians. So we really do feel like we're attentive to everybody's needs, patient and family, and we're helping guide those patients and families through every step of the way. The community is very important to me. I'm born and raised in Philadelphia. I was educated up and down Broad Street from high school, college, medical school, and my training in medicine. One thing I enjoy very much getting involved in is local community events. I have a strong passion for running, and one of my favorite races is the Broad Street Run. This is a race that benefits the American Cancer Society. I first ran that race in 2007 with my wife, the year we met. But subsequently, every year I run that race and enjoyed it. The reason I really enjoyed it is I'm able to reconnect with some patients along the way. A number of my patients have either run the race or have had family members that run the race in their memory. Still every year I'll eventually get updates from other family members that I've known over time and patients that I've cared for. Just touching base around Broad Street Run date in May, and that's a special time for me. Locally, there's the Kevin Kane Foundation, which holds its annual 5K race in March that we all participate in here at the practice, and it's a nice way to get our group together and reach out and engage patients outside of the office. Our practice is willing to see any patient with an abnormality on any imaging that is suggestive of or concerning for cancer without a formal cancer diagnosis. So the reason we do this is it really helps the patient and their families and the primary care teams navigate the situation quickly and efficiently, which helps limit patient anxiety shortens the time period it takes to work these things up and confirm a diagnosis, and allows us to develop treatment plans that are going to help either palliate or address the underlying problem with each individual patient.